Cardiovascular disease refers to disease of the heart and the blood vessels, also known as the circulatory system. But it takes on a more specialised meaning of a process that blocks arteries and deprives organs of their blood supply, most importantly, blockages of the coronary arteries causing heart attack and blockages of the cerebral arteries causing stroke. That blockage usually involves a chronic inflammatory process featuring deposits of cholesterol in arteries, and it usually only progresses to an acute event when a clot occurs on top of that. Cardiovascular disease is a multifactorial disease. Therefore, you have to have a commitment to address all the different aspects. One thing to stress is that the measures we take to prevent cardiovascular disease are also very appropriate for the avoidance of diabetes, cancer, cognitive decline, osteoporosis and obesity. So there's a potential for a core philosophy that largely addresses all the major chronic diseases. And what is that core philosophy? Well, a healthy diet is a very complicated concept and one which we all need to work out. Then our basic habits like non-smoking, getting adequate exercise, maintaining ideal weight and controlling risk factors like cholesterol. And particularly with diet, it's important to emphasise the impact of things over long periods of time. Chronic disease is cumulative. If you intervene gently for a long period of time, you massively amplify the benefit you can have. Let's look at the influences or risk factors for cardiovascular disease. The causes of cardiovascular disease are gene-environment interactions which occur against a background of non-modifiable risk factors. These non-modifiable risk factors include gender and age, so women are better protected than men up to the menopause. Furthermore, being a chronic problem, cardiovascular disease is going to be more severe in people as they reach older age. Not much we can do about these things. The same might be said of genetic factors, but they usually influence modifiable risk factors which are more amenable to treatment. As an example of a situation where the genetic component predominates, we can point to a condition that doubles the level of cholesterol in the blood and brings forward heart disease and stroke by 30 to 40 years. This condition, known as familial hypercholesterolemia, or FH, affects 1 in every 250 people worldwide. Then we move to the modifiable risk factors like smoking and diet, and this is where we can have a more direct influence. In epidemiological terms, we can look at societies in which cardiovascular disease hasn't been present. We can see historical trends where it becomes more prevalent, and we can delve into different societies and see bad habits that are associated with cardiovascular disease. So we've seen rates of smoking and how decreased rates of smoking have had a beneficial effect. We see changes in diet, and we need to recognise that different diets bring about different circumstances. There is more than one harmful diet and more than one healthy diet, and sometimes we find ourselves in a transition between the two. Beyond diet, the availability of food on its own starts to affect calorie balance. When we have a low activity level and calorie imbalance, we have problems with obesity. Obesity causes problems not only in elevating blood glucose and contributing to diabetes, it also affects the amount of fat in the blood, fat being called triglyceride. And those high fat levels can modify the cholesterol-carrying particles in the blood to have an adverse effect on the risk of heart disease. This may disturb the balance between cholesterol on its way to tissues, where it might cause damage, compared to that on its way back from tissues where it might be providing protection. We've become convinced just recently that the problem lies more with delivering of damaging cholesterol to tissues. Metabolic syndrome is often seen as high triglyceride, low HDL. It does appear that this combination is detrimental for cardiovascular health. It's quite different from the high damaging cholesterol, which is a separate risk factor for cardiovascular disease. We can often get a little confused about why people with normal cholesterol level get into trouble. If they've got diabetes or obesity, they could well have this metabolic picture of high triglyceride, low HDL. We do think that a low HDL can be damaging, but there may not be a converse protection from a high level of HDL. We've learnt that we can't boost HDL to give protection. That's not been a successful strategy. What we've got to do is get rid of the damaging stuff like cholesterol and triglyceride. We have some metabolic markers for the changes associated with cardiovascular disease in the metabolic syndrome. These include metabolic markers of adverse changes in inflammation and clotting, as well as diabetes itself. Care is required regarding some of the diet advice targeting weight loss in the popular media. A weight loss diet is not necessarily metabolically healthy from a cardiovascular point of view. A number of diets are consistent with good cardiovascular outcomes. The so-called DASH diet is highly regarded amongst dietitians. It has a lot of features in common with the Mediterranean diet. But I do think we have to be careful about interpreting a Mediterranean diet in an affluent culture, because there is a tendency to sneak in or increase foods that are undesirable. We look favourably on the inclusion of fish, vegetables and fibre in the diet, as well as variety and selection of foods according to seasonal availability. And priorities do change, so diets should be varied at different stages of life. Regular milk for young children, the inclusion of iron for women of childbearing age, etc. Most importantly, every effort should be made to include nutrient-dense foods in place of those that are energy-dense. We can have academic discussions about diet, whether it's good or bad, often in terms of food composition, and the media will often pick this up in terms of surprising messages like maybe saturated fat is no longer harmful. We are trying to move more in the direction of advising diet in terms of style and cuisine, but we do have to continue to consider the underlying facts. For example, in this debate, one of the recent publications suggested that a 20% tax on saturated palm oil would save approximately 1/3 lives in India over the next 10 years. So it's just this message of what small incremental things we can do. And it's these very populous countries which are changing their diets very rapidly, unfortunately in the wrong direction, that are driving an epidemic of cardiovascular disease in the developing world. In the developed world, we've become a bit complacent, and cardiovascular disease might be mistakenly regarded as a preferable demise to things like cancer and dementia. But if you have an effective cardiovascular disease prevention program, you will reduce those causes of death and disability too.